First, can I give you a big hug?
Yeah.
Okay.
I'm so glad we got back in touch.
I know. How's it? What's the history for us? I think it goes back to
Residency.
2009.
Yeah, is that when you started residency? We were 2 years.
Pick which one.
Well, okay, fair.
Which
family medicine?
Well, yeah. This was not my first rodeo. So, it's, what was it? Second residency, so family medicine, 2009, June.
Yeah, there you go.
And we met, I think, on my first rotation even, possibly.
Possibly. Was that inpatient?
Yeah.
Yeah. Yeah, and I was your senior.
Yeah.
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 That was a long time ago.
I know. Holy cow. This is for, I guess, the people who are watching are not just practitioners. They may be.
Sure.
My guess is many, but that there may be other people in other professions to know, what is it like to train to be a medical doctor, which I don't know about you, but people don't have any idea what it takes. And it doesn't mean that, it's not like you get to the promised land and you get up to the top of the mountain and suddenly there's all this glory and everybody loves what you do. It's not like that at all. In fact, you get beaten down again and again and again. But the experience itself is traumatizing.
Oh, yeah, for sure.
Yeah. I was wondering if you could share. I'll be happy to chime in. I've been chiming in my whole series, but I kind of want to take a step back here.
Yeah.
Yeah.
I mean, it is. And I think, people say it's tough, but I don't feel that I either really believe people that it was tough, or I definitely didn't have anyone say, hey, it's traumatizing. Like, this is doesn't, and each person's experience is different, right? Like, what's traumatizing to one person is going to be different to another. And so for some people, it might not have felt traumatizing. But I've been able to reflect back and recognize that, especially as someone who really wants to connect with the people I work with, like doing healing work with, and the way our, just the overall system tries to shove as much in at a time, where you're having short appointment times. You don't really have space to connect, and you don't really have space to reflect. That's damaging in its own right to the people who are receiving care, but to us as well, who want to be a human in the experience, in reality. So can we stop and reflect on what really is wellness for each of us individually? But if we don't have, we don't have time to have that conversation, to get to know, what is wellness to you? You person who are sitting here that I'm trying to support healing. Well, what's wellness? Because if you're following the model the way the model is of placing the authority in the medical provider, which obviously you do not ascribe to, I do not ascribe to.
No.
And I do not think it is best for anyone, because it also, if we sit in that hierarchy as providers, then it puts too much pressure on us.
It's also not healthy to be devoid of any structure. So rather than being in this hierarchical, I am, lording over you, do as I say, aggressive medicine, passive patient.
Right.
There should be a facilitative role.
Right.
Because we have that training, we have that expertise to hold the space for that person. And so there should be some structure, because you need a vessel in order to contain a manageable place to do the healing, because in the real world there are no boundaries. But in order to make changes, sometimes you need to create little vessels to do that.
Yeah, and to be held, right? I think, we touched on somatics earlier, and that's a practice that as a practice of connecting into body, and listening, or that's the verb I use, or sensing, you could use sensing, into what your body's asking for. Because our bodies are wise, right? Our bodies are always trying to take care of us. Again, not what I feel like I was taught in my Western medicine training, but what I believe is our bodies are trying to take care of us. They wish the best for us and are trying to communicate, hey, I need this to shift. And that's what symptoms are.
Constant emails, right? and letters and so many things that our bodies are sending us all the time.
Right, exactly. I have made my work what I love.
Right.
And I think there's a way to do that. And so then for me, it's like, how do we also like help our way of working and supporting others be generative and joyful? How do we help it be like, I love doing my work. It is so much fun. I love it. It brings me joy. I wouldn't want to not. I will, even if I chose to release my licensure, I would still be doing healing work in some form because that's what I do.
I think
that's a thing.
I think you're right, because my joy is not in leaving medicine at all. It was recreating it in a way that I can just pour my essence of who I am into the work without draining myself.
Exactly.
And it actually heals me too. I restructured my business so that I'm in my business plan, so that I count. And that's something that is giving me a lot of joy to see where it goes. Like conversations like this one are just wonderful.
Yeah.
Yeah. Appreciate it.
Thank you. Me too. I mean, I'm really glad that we reconnected. It's been,
me too.
Like, as you touched on earlier, like, it feels alone. And so, like, and there's something particular about being seen and appreciated by other people trained in the Western medicine model with an MD or a DO. Like, there's something about that's like, oh, you get me in a way that someone else can't.
I get you, Kaeri.
I know, and I appreciate that. Thanks, Barbara.
I know what you mean. I know what you mean, because you can be. We've been in the trenches together.
Yeah,
it's part of it, and that it's. I don't even want to say the word validation. Maybe part of it. An acknowledgement. Next time we can talk about, I don't know where this will go, but just more healing, maybe how you're doing.
Sure.
In your journey, and then how I'm doing too.
Yeah.
Check in.
That sounds good.
Okay.
I like it.
All right. Thank you.
Yeah.